Hi everybody, it's Kim Bergen-Jackson, COO of Health Services and Administrator at Oak Knoll, and I'm recording on Wednesday, October 2nd for your viewing pleasure on Friday the 4th. Before I forget, I wanted to say that today, the 2nd, is Steve Cuppy's birthday, and Steve Cuppy is our site manager at the East location, so happy birthday to Steve. And on Friday, we are celebrating his 20th anniversary. He's having a card party because large groups of people, that's not his favorite thing. So if you wouldn't mind filling out a card and giving it to Kim Herring at the main campus or give it to Kathy Vance at the East location, and we'll give him a big card party and celebrate 20 years. If you don't know Steve, he is incredible, but he likes to be sort of the observer in the room. So he's not as woo as me, you might say. He's not big on, being the center of attention, but I am enough for all of us. So those are my updates about Steve Cuppy. I have an empty chair sitting here for you, and I'll tell you why in just a moment. But I wanted to give you the COVID update. We have a handful of residents in independent living who have very mild COVID cases right now. This morning when I counted, there were 6 that I knew about. They are not connected to each other, and they are isolating in their apartments and following all the regular protocols. I would say travel is probably your highest risk right now, although I went to Alaska, as you know, and Kim's going to put in some pictures for you because it was amazing, and I didn't get COVID. So how about that? Last time I went on a trip, I got influenza A, if you remember, and the time before that, I got COVID. So I'm very happy to be back at Oak Knoll and healthy and boosted. So if you didn't get vaccinated on the 20th, you still have a chance to get your updated COVID vaccine. All the local pharmacies are carrying them. Most of them have online register system, so you can sign up for an appointment, and there should be no cost to you. So please get your vaccination for COVID and influenza and RSV if you haven't had it. I don't have any cases of COVID in the health center or assisted living, and none among the staff. So let's celebrate that. There are no masks currently required in the health center. That have been for quite a few weeks. So, of course, as always, if you're more comfortable wearing a mask, please do wear your mask. Nobody's going to tell you not to wear a mask, but we're not making people wear them right now. If you become symptomatic, as always, check and make sure that that's not your problem. Maybe you just have a real cold or seasonal allergies or something else. But if you become symptomatic, we'd like you to stay away from folks and wash your hands and do all the things you've been doing for almost 5 years. So I know you're tired of me talking about that. So let's get to the best part of the video today. I have a guest speaker joining me today. I'm going to have her join and sit in the chair. I am delighted to introduce everybody to Amber Jedlicka, and I'm going to give her a chance to tell you a little bit about herself. She's our new administrator. So hi, Amber.
Hi, Kim.
Nice to see you.
Thank you.
Yeah, and introduce yourself to everyone.
Hello, everybody. I'm Amber Jedlicka, and excited to be here. This is day 2 for me at Oak Knoll. My first day, had an amazing onboarding experience. Thank you, Chrissy and Andrew. You two are beyond professional, and I understand why new hires are successful here at Oak Knoll. So at Oak Knoll, I'm meeting a lot of people. So thanks to everybody for introducing yourself, saying your names. You'll probably have to do that a few more times for me. My background is that I come to Oak Knoll with a little over 22 years of experience. My passion for the aging services field started at a young age, and I went to college knowing that I wanted to work hard to improve the lives of older adults, and started at the age of 22 for Friendship Village in Waterloo. I was the director of their assisted living, young, and so I have grown up in this field. My passion is deep. I spent 11 years with Friendship Village and then wanted to move our family closer to home, and Methwick Community hired me. I spent just over 11 years at Methwick Community. 8 of those years was the director of health services, so overseeing the nursing home. I am super excited to be here. Thank you so much, Kim, for the introduction, and looking forward to meeting more people.
That's great. I'm thrilled that Amber's here. She's wonderful. We've known each other for several years. We are on the board of directors for Leading Age Iowa together. So we're very good friends, and the hiring committee could not have picked a better person for Oak Knoll. So I am thrilled and relieved that Amber's here and has started. So when am I leaving is the question. I don't know yet. So I'm going to be here less than 40 hours a week or 50 hours a week, maybe 20 hours a week while I transition over to the college and sort of help Amber get settled in. Really the hardest part about Oak Knoll is learning where the heck you are in the buildings. And learning all the people. And she doesn't need me for that. And she doesn't need me to tell her how to be an administrator because she has lots of experience. So I'm just showing her some systems and stuff around, and then I'm going to get out of her way. But I will be here with students on Wednesdays, roaming around and connecting with people. So you're not completely getting rid of me ever, but I would start reaching out to Amber in the next week or so if you have concerns. But reach out to your people first. So in independent living, that's Stacy and Scott and Sarah Neary. In assisted living, that's Jacqueline and Sarah Neary again. In the health center, it's Sarah Ruhlman and Kate Byrink and Kaylee Gilmore. So you all have first line to get to. You can still email me, you can still call me, but I'm just going to loop Amber in on everything. So we're trying to make this the best possible transition for her so that she'll be happy and wildly successful. And I will miss you guys. So we're going to have a party next week for me. So don't, no tears though, only fun at the party. So I'll see you. Well, maybe I'll see you. Maybe Amber will do the video by herself in 2 weeks. We'll see. It'll be a surprise. Take care. Have a great week. And we'll see you again.